Dr. Brian Allen from Mesa, Arizona. I am a foot and ankle surgeon, podiatric surgeon, board certified, and I've been doing cryo for the last 16 years. Been a big part of my practice, very important to me and my patients in that it is allowing them to return to work quick and a much shorter recovery for my patients, as opposed to the surgical means to treat a lot of the pathology in the foot and the ankle. These patients are finding that they can return to work and to their home life much quicker than surgery. So it's been a good treatment in the arsenal, for pain, for things like neuromas, plantar fasciitis, traumatic injuries that involve chronic nerve pain. It's been very helpful to my patients and to my practice. But basically what we're doing is we're taking extremely cold temperatures and we're destroying and disrupting that pain pathway through those nerves, allowing a analgesic effect. And it's an effect that can last for many months, and in the literature it can last for years without causing damage, permanent damage to the nerve in terms of numbness or a neuroma or another painful situation. And so this is being used for things that we commonly see in the office, like neuromas, plantar fasciitis, nerve entrapments, those medial dorsal cutaneous nerves that are maybe entrapped with an exostosis. And so this is a great product, great procedure for those type of conditions. You can also use them for skin lesions. I do use them for verruca or warts, and very effective. When my chemocautery agents don't work, this is a great thing to pull out to destroy those skin and dermal lesions, which, by the way, is being used in lots of other specialties for lesions, including lesions in the kidney, the liver, and again, lots of other specialties. I think in podiatric surgery, again, we're a little bit behind, but I'm foreseeing that we're going to catch up hopefully pretty quickly. It's pretty easy. It's about 6.5 minutes for the procedure. It's not going to take a lot of time in the office. I numb them up locally like I would, as an example, a neuroma injection, and I would get them numb first. I make a very small cut in the skin, again, minimal. I use a little spatula, like a little freer elevator, to free up the soft tissue, and I insert a very small probe into that area. And the tip of the probe gets mighty cold. It's minus 70 degrees Celsius, which is like minus 200 Fahrenheit. And that is then frozen in a very rapid 3-minute freeze cycle, a slight 30-second thaw, another rapid 3-minute freeze cycle. And that rapid freezing, thawing, freezing causes the disruption of the axons in the myelin sheath, but doesn't do anything to the rest of the nerve, including the epineurium, the perineurium, the endoneurium. Those all remain intact. And that's why our patients, end up not developing some type of stump neuroma or some other condition. So it's very fast, it's very quick, and the patients go home with a light bandage. I don't typically put them in a cam walker boot. I know some might, but the patients typically don't need even a walking boot. And I tell them to be a couch potato for about 3 days, take it easy, maybe start to resume athletic activities within a couple weeks. They will have a very small incision that's made through the skin. There's normal healing that takes place with that. Pain is not too intense. In fact, I'm not even having to give them any pain medication. They can take an over-the-counter anti-inflammatory. And so it's just not a painful process for my patients post-cryo. I think my patients kind of give me this awe effect, like, wow, I can't believe that, this is an option for me. A lot have not heard of it. And again, I think with it being utilized in so many specialties now, more are becoming, accustomed to hearing about cryogenic neuroablation. But really, it's kind of an awe effect for the patients because they've never heard of it, they've never seen anything about it, And so when you talk about surgery with patients, the majority of them really kind of back off, and they want to know, hey doctor, are there any other treatment options available to help me? If they've exhausted the cortisone shots and the medications, the NSAIDs, they've exhausted physical therapy, they've exhausted all those other conservative treatment options, and your next conversation would be about surgery. Still, many patients want to know, is there anything else that can be done? And certainly there is. Again, this is a great treatment option in the arsenal for these foot and ankle pathologies and this chronic pain that we're talking about. This is a cash pay service that's provided in the office. And the insurance companies, from my understanding, are still calling this experimental, like a platelet-rich plasma injection or an amniotic injection that many of my colleagues are familiar with. So this is still classified as experimental. Again, as research comes out and as these samples of population get larger in these studies, I think it'll be more accepted, certainly by the insurance companies. But currently, my charge to the patient is about $500, which definitely is covering the expenses, and I think well worth the incentive for the patient, again, to try and get better. Certainly, I've set my price at that for 16 years. I haven't modified it or changed that. I have no difficulty in talking about that cost with a patient and then being hesitant or resistant to having this cryosurgery based on cost. Again, I set the price. I've got another colleague that I trained who charges quite a bit more than that. And so really you can set the cost for what you would like. It's really kind of up to you. But I've set mine at about $500. And again, I don't see this being a difficult hardship for patients in my area. And I purposefully set it at about $500, just knowing that that was a much easier thing for people to do.